Hi, welcome to this video diary that I'm recording as a diary about the progression of diagnosis of multiple sclerosis. I hope that me recording my experiences as I go through this process will help people to understand exactly what the process is, what it means, etc., etc. Last year I started noticing that when I was walking I couldn't walk in a straight line like along a tightrope or anything, and I felt that as I was walking down corridors or downstairs I was constantly reaching out and touching the walls to make sure I knew where to get some stability if I needed it. I started having physiotherapy, just general physiotherapy and cranial physiotherapy to see if that would alleviate the problems. I even went to see an ear, nose and throat expert who said that it might be a viral infection on my inner ear, and he gave me treatment for that, and yeah, it made things better for a while, but then they went back to bad again. And so it wasn't really talked about very much more. Certainly I didn't discuss it with my doctor or anything. But then in September last year I went to see her because I had pins and needles in my fingers. I couldn't get rid of it. They always have pins and needles in them. And I noticed that there was a lack of sensitivity in them that meant that I couldn't tie my own shoelaces without actually looking to see what I was doing. My son, who's just turned 4, if I wanted to do a bib up on the back of his neck, I would have to look very closely and see what I was doing to tie the knot. I've never been a very good touch typist by any stretch of the imagination, but even so I found myself looking down at the keyboard a lot more than I would normally do, and find myself making far more typos than I would normally do. So I went to see a neurologist, recommended my doctor to see if it was a problem with carpal tunnel syndrome, which is an affliction that occurs to a lot of people working with computers all day long, like I do. And so I went to see him. He strapped some wires to my fingertips and to my elbow and jumped current through to see the timing of the nerves, to see how quickly they would react. And he said absolutely nothing. It was fine. Didn't have carpal tunnel syndrome. Yay, I thought. And then he said, well, let's have a look and see if there's another cause. Which he did, and then he suggested I go for an MRI. He wasn't very happy with the results of that first MRI, so he suggested I go for a different one. The first one was of my neck area, vertically onto the side of my neck, if you like, and then the next one was a set of slices down through my head and also horizontally across my head or vertically across my head. And what they were looking for was little white spots that indicate lesions on the myelin sheathing around my nerves. Now, these lesions, these scars, are what is the sclerosis part of multiple sclerosis, and the fact that I have a fair few is the multiple part. And so it's possible that I had it. Now, I say it's possible because even with that evidence and with my symptoms, there are a number of autoimmune diseases, because multiple sclerosis is classified as an autoimmune disease. It's the body attacking itself that's caused these problems. There are a number of different causes for it. It's necessarily multiple sclerosis. So yesterday I went for further tests. I had about 200 pints of blood taken out of my arm, and that really is nearly an armful. Not really, but it was a lot. It was a lot of little tubes about this big, and there were about 20 of them, and they all go off in different directions for different tests. I also had a lumbar puncture, which isn't as bad these days as it once was, because I had an anaesthetic patch applied to my spine about an hour before the event, and the event itself, I sat on my bed, curled over a pillow to round my back as much as possible, to space out the spine as much as possible so they could slip a needle in easily. And they drew out about that much clear liquid, which is your cerebrospinal fluid, for further tests. And oh, by the way, you get an anaesthetic here, but I'm not sure if there is one given yet in England. I live in France now. I'm speaking to you from near Bordeaux, and the hospital that I attended, which is the CHU Pellegrin in Bordeaux, is one of the finest in France. It's the best maternity hospital in France. It's also a university hospital, so there's a lot of medical experiments that go on, and drug trials and so on and so forth. So if there was anywhere that would be good to get MS, then this is going to be one of the best areas, certainly in France, and probably pretty much in Western Europe. So I'm hopeful that these guys are going to do good by me. Next week I have to go in for a horse dose, as the nurse gleefully put it, of corticosteroids, and the reason they inject you with a gram, it is, per day of this stuff, is to calm down the inflammation in the myelin sheathing, to try and prevent any further lesions from happening. It apparently will have great results in that it will probably ease the amount of false signals that my nerves are sending, etc., etc. But I really don't know yet. This is a journey of discovery for me, just as it is for you, dear viewer. I'll carry on this diary, and I'm sorry it's taken so long to get it going. I had told friends of mine that I was going to do it more than a week ago, but technically this hasn't been so easy. What I'm using now is Logitech QuickCam Communicate STX to film this, but there have been a lot of other experiments that have taken time. So I'm going to leave it at that for the time being, because there's a limit on how long you can record for on YouTube, etc., etc., and the file size as well. So I'm keeping a careful eye on that, which is why my eyes keep slipping down to the side. Oh, also, since this is a diary piece and it's kind of like talking to a mirror, I've reversed the polarity on the camera that is mirrored horizontally, so this is actually my left hand that I'm wearing a wedding ring on. And I know for sure, this might seem a bit sentimental to say, but what's going to keep me strong above all is my fantastic wife and my brilliant son, and I love them dearly, and I thank them very much for helping me through this. Thanks all, good night.